So today we are discussing about hypoglossal nerve. So the hypoglossal nerve is a 12th cranial nerve and it is entirely motor in function. The hypoglossal nerve is a purely motor nerve. It is a 12th cranial nerve and it is in series with the 5th, 6th cranial nerve as well as the ventral roots of spinal nerve. It is in series with the 5th, 6th cranial nerves as well as the ventral roots of spinal nerves, and this hypoglossal nerve, it is formed by the upper four pre-cervical segments. It is formed by the upper four pre-cervical segments ventral roots. The hypoglossal nerve, it is formed by the ventral roots of upper four pre-cervical segments. We will discuss them in somites. During the somites in embryology, we have discussed about the occipital myotomes also, and this hypoglossal nerve, it arises from the upper roots or upper pre-cervical segments ventral roots, and the dorsal roots are disappears. Though the hypoglossal, it is a more spinal in function and cranial in origin. So hypoglossal, it is more spinal in function and cranial in origin. Okay, so the hypoglossal nerve, it is arises from the hypoglossal nucleus, which is about 2 centimeters long, with the hypoglossal triangle, which is situated in the floor of the fourth ventricle, and here this is the hypoglossal nucleus. So this hypoglossal nucleus, it receives corticonuclear fibers from the cerebral cortex. This hypoglossal nucleus, it receives corticonuclear fibers from the cerebral cortex. The hypoglossal nerve, it receives corticonuclear fibers from the cerebral cortex. Okay. So, how the corticonuclear fibers arise? So, the motor area and premotor area. We know that in the cerebral cortex we have area 4 and 6 are present. In the cerebral cortex we have area 4 and 6 are present. Area 4 and 6 are present in the motor area as well as the premotor area. Motor area and premotor area. Area 4 and 6. So from the area 4 and 6, the fibers from the area 4 and 6 of the cerebral cortex, the fibers comes from the area 4 and 6 of the cerebral cortex, and they reach the hypoglossal nucleus through corticonuclear fibers. Okay, so from the area 4 and 6, the motor and premotor areas in the cerebral cortex, the fibers arise and they reach the hypoglossal nucleus through corticonuclear fibers as well as from the cerebellum as to the nucleus intercalatus. From the nucleus intercalatus, from the cerebellum also they receive fibers from the nucleus intercalatus, and from the cerebral cortex also area 4 and 6 they also receive fiber. The hypoglossal nucleus, it receives fibers from the cerebral cortex area 4 and 6, and from the cerebellum from the nucleus intercalatus. Okay, so from the hypoglossal nucleus, 10 to 15 rootlets arise. From the hypoglossal nucleus, 10 to 15 rootlets arise. 10 to 15 rootlets arise from the anterolateral sulcus of the medulla. 10 to rootlets arise from the anterolateral sulcus of the medulla between the pyramid and olive. In the medulla we have pyramid and olive is present. This is the olive and this is the pyramid. So this is the anterolateral sulcus here. This is the anterolateral sulcus here. So between the pyramid and olive, 10 to 15 hypoglossal rootlets arise. 10 to 15 the nerve rootlets arise from the anterolateral sulcus between the pyramid and olive, and they reach the hypoglossal canal. They reach the hypoglossal canal behind the fourth part of vertebral artery. Behind the fourth part of vertebral artery, they reach the hypoglossal canal, and these rootlets, they are arranged in the form of 2 bundles in the hypoglossal canal. So these 10 to 15 hypoglossal rootlets, they are arranged in the form of 2 bundles in the hypoglossal canal, and these rootlets, they reach the hypoglossal canal behind the fourth part of vertebral artery, and they are arranged in the form of 2 bundles in the hypoglossal canal, and these bundles in the lower part of the hypoglossal canal, they unite and form hypoglossal nerve. Okay, so how the rootlets come out. The rootlets, the 10 to 15 hypoglossal rootlets, they come out between the olive and the pyramid in the anterolateral circus, and from there they reach the hypoglossal canal, and in the hypoglossal canal the rootlets, they are arranged in the form of two bundles, and these rootlets in the lower part of the hypoglossal canal, they united to form the trunk of hypoglossal nerve. They united to form the trunk of hypoglossal nerve. And the hypoglossal nerve, it runs downwards with it runs downwards, and it makes here we have vagus nerve is present, and the vagus nerve has a inferior ganglion is present in the vagus. It makes this hypoglossal nerve, it makes a half spiral turn over the inferior ganglion of the vagus. It makes an half. This is the vagus nerve, and this is the inferior ganglion of the vagus nerve. Okay, so this is the inferior ganglion of the vagus nerve, and this hypoglossal nerve, while descending downwards, it makes a half spiral turn. It makes an half spiral turn over the inferior ganglion of the vagus. Usually, after coming from the hypoglossal nerve, this hypoglossal nerve, it lies deep to internal jugular vein, internal carotid artery, as well as the 9th, 10th, 11th cranial. It lies deep to internal jugular artery, internal jugular vein, and internal carotid artery. It lies deep to internal jugular vein as well as the internal carotid artery, and also it lies deep to 9th, 10th, and 11th cranial nerve. And now what happens here is it makes an half spiral turn over the inferior ganglion of vagus, and it is in contact with the vagus by in a connective tissue. It is contact with the inferior ganglion vagus in a connective tissue, and it runs vertically downwards over the vagus between the internal jugular vein and the internal carotid artery, between the internal jugular vein as well as the internal carotid artery. It runs forwards and downwards between the internal jugular vein and the internal carotid artery, and in front of the vagus nerve, and it pierces the posterior belly of digastric as well as the stylohyoid muscle. We know that posterior belly of digastric arises from the mastoid notch here. We can palpate the mastoid process behind our ear, right? So, in the mastoid process, we have a mastoid notch is present here, and so we can see the mastoid notch here. So, this is the mastoid notch. Okay, this is the mastoid process, this is the mastoid notch. So, the hypoglossal nerve, it descends downwards, and here it pierces the posterior belly of digastric as well as the stylohyoid muscle, and it enters the carotid triangle. Carotid triangle between the internal jugular vein as well as the internal carotid artery. Okay, here the hypoglossal nerve, it is covered by skin, superficial fascia, and also platysma and the investing layer of deep cervical fascia. And here it enters the carotid triangle at the angle of the mandible. And this hypoglossal nerve, it is crossed superficially by the common facial vein. So the hypoglossal nerve, after emerging from the hypoglossal canal, so this is the hypoglossal canal, right? After emerging from the hypoglossal canal, usually it lies beneath the internal jugular vein and internal carotid artery, and also 9th, 10th, 11th cranial nerves. Then what happens? This hypoglossal nerve, it makes a half spiral turn around the vagus nerve, inferior ganglion of vagus nerve, and it descends downwards in front of the vagus between the internal jugular vein and the internal carotid artery. It runs downwards and forwards, and it enters the carotid triangle of the neck by piercing the posterior belly of digastric as well as the stylohyoid muscle, and it enters the carotid triangle of the neck. And after at the angle of the mandible, and where it is covered by skin, superficial fascia, platysma, and investing layer of deep cervical fascia, and it is crossed by the common facial vein. Then this hypoglossal nerve, it passes across the hyoid bone. This hypoglossal nerve, it passes across the hyoid bone. And while passing across the hyoid bone, it crosses the stenomastoid branch of the, it crosses, it spirals around the lower stenomastoid branch of the occipital artery, lower stenomastoid branch of the occipital artery. It passes about the internal carotid artery as well as the external carotid artery. It passes over the internal carotid artery, it crosses the internal carotid artery, external carotid artery, and it crosses the hyoid bone, and also it crosses the loop of first part of lingual artery also. It crosses the loop of first part of lingual artery, and it enters into the digastric triangle. It then enters into the digastric triangle. It enters into the digastric triangle. So here the hypoglossal nerve from the carotid triangle, it enters into the digastric triangle. So how it enters into the triangle? It crosses the internal carotid artery, and it crosses the external carotid artery, and also lingual artery. And also lingual artery, it is nothing but a branch of external carotid artery, and it crosses the hyoid bone, and it enters into the digastric triangle. It enters into the digastric triangle. In the digastric triangle, it rests on the hypoglossal muscle. It rests on the, in the digastric triangle, it rests on the this hypoglossal nerve. It rests on the, this hypoglossal nerve rests on the hypoglossal muscle. Okay, this rests on the hypoglossal muscle. Here, the hypoglossal nerve here, it is accompanied in the digastric triangle. It is accompanied by a pair of veins. It is accompanied by a pair of veins in the digastric triangle. We call this as the vena commitans nervi hypoglossae. We call this one as the vena commitans nervi hypoglossae. Vena commitans nervi hypoglossae. Okay, so the after entering into the digastric triangle, the hypoglossal nerve, after entering into the digastric triangle, the hypoglossal nerve, it rests on the hypoglossal muscle. Here, it is accompanied by a pair of veins. We call it as vena commitans nervi hypoglossae, and here it rests on the hypoglossal muscle. Then it pierces the mylohyoid as well as the genioglossus muscle. See, here we have tongue is present here, and we have genioglossus is present here, and then the hypoglossal nerve, it enters into the genioglossus muscle, and it supplies the substance of the tongue. It enters into the genioglossus muscle, it pierces the genioglossus muscle, and it supplies the substance of the tongue. Okay, so in the digastric muscle, the hypoglossal nerve, in the digastric muscle, the hypoglossal nerve, it is related to the lingual nerve. It is related to the lingual nerve. It is related to the lingual nerve, and also it is related to the deep part of submandibular gland and submandibular duct, and also it is related to the submandibular ganglion. It is related to the submandibular ganglion. We have discussed them in detail regarding the tongue. Regarding the tongue, we have discussed all these things in detail regarding the tongue. So, the hypoglossal nerve in the digastric triangle, it is related to the deep part of submandibular gland. We have discussed it in this point in the during the submandibular region, and also submandibular duct, and also lingual nerve, and also submandibular ganglion, which is suspended from the lingual nerve by two roots. So, the hypoglossal nerve, it is related to all these structures, and then it passes deep to the mylohyoid, and it enters into the pierces the genioglossus, and it supplies the substance of the tongue. Okay, so the hypoglossal nerve here from the carotid triangle, it enters into the digastric triangle. By how it enters into the digastric triangle means it winds around the lower border of stenomastoid branch of occipital artery. It winds around the lower stenomastoid branch of occipital artery. It crosses the internal carotid artery, external carotid artery, and loop of first lingual artery, and then it enters into the digastric triangle. Okay, in the digastric triangle, it rests on the hypoglossal muscle. In the digastric triangle, it rests on the hypoglossal muscle, and here it is accompanied by a pair of veins. We call them as vena commitans nervi hypoglossae, and it passes deep to the mylohyoid muscle, and it pierces the genioglossus, and it supplies the substance of the tongue. In the digastric triangle, it is related to the lingual nerve. So this is the lingual nerve, this is the submandibular ganglion, and this is the deep part of submandibular gland, and also this is the submandibular duct. It is related to all these structures. Okay. So, what are the branches of the hypoglossal nerve? What are the branches given by the hypoglossal nerve? So, coming to the communicating branches. Communicating branches of the hypoglossal nerve, it communicates with the superior cervical ganglion. It communicates with the superior cervical ganglion, and also the hypoglossal nerve, it communicates with the inferior ganglion of the vagus. It communicates with the inferior ganglion of the vagus, and it communicates with the C1 fibers. It communicates with the C1 fibers. This is nothing but we have discussed them means ansa cervicalis. We know that C1, C2, C3, and the C1 and C2, from the C1 and C2 we have a branch coming here carrying the fibers of C1. This branch along with the hypoglossal nerve, this is the hypoglossal nerve and this is the C1 fibers. Okay, they supply the thyroid and genoid muscle. They supply the thyroid as well as this is the hypoglossal nerve, and this is nothing but the C1 through hypoglossal. This is nothing but the C1 through hypoglossal, which carries the fibers of C1. It supplies the thyroid as well as the genoid muscle. So it communicates with the C1 fibers. It communicates with the C1 fibers, and also a branch from pharyngeal plexus. A branch from pharyngeal plexus also communicates with the hypoglossal nerve. A branch from pharyngeal plexus also communicates with the hypoglossal nerve, and in the digestive triangle, the hypoglossal nerve communicates with the lingual nerve also. The hypoglossal nerve communicates with the lingual nerve, and it carries proprioceptive senses. It carries proprioceptive senses from the tongue muscles to the mesencephalic nucleus. It carries proprioceptive senses from the tongue muscles to the mesencephalic nucleus. So, these are the communicating branches from the hypoglossal nerve. So, the hypoglossal nerve, it communicates with the superior cervical ganglion. It communicates with the inferior ganglion of vagus nerve. It communicates with the C1 fibers, C1 through hypoglossal, and it communicates with the pharyngeal plexus, and it communicates with the lingual nerve by carrying proprioceptive fibers, proprioceptive sensory fibers from the tongue muscles to the mesencephalic nucleus. Okay, so we know that the C1 through hypoglossal here. So C1, C2 and C3 is present. So, from the C1 and C2 fibers, they form a loop. From the loop, a branch comes here and it communicates with the, and it here, this branch communicates with the, hypoglossal nerve. This is the hypoglossal nerve here, and this is branch carrying the C1 fibers. It supplies the thyroid as well as the genoid muscle, and a descending branch comes here. And descending branch comes here, we call it as descendens hypoglossal here, descendens hypoglossal, which supplies the superior belly of omohyoid, and from the C2 and C3 loop, and then descending branch comes here, we call it as descendens cervicalis. We have already discussed all these in ansa cervicalis during the anterior triangle of the neck, and here this descendens cervicalis joins with the descendens hypoglossal and forms the ansa cervicalis, loop of ansa cervicalis, which supplies the three muscles, nothing but the omohyoid, inferior belly of omohyoid, stenothyroid and stenohyoid, inferior belly of omohyoid. It supplies all these muscles, stenothyroid, stenohyoid and inferior belly of omohyoid. Okay, so C1 through hypoglossal nerve. Okay, coming to the, what are the branches? Communication or now distribution branches. What are the distributing branches? So, after emerging from the hypoglossal canal, the hypoglossal nerve, it gives one important branch, that is nothing but the meningeal branch. After emerging from the hypoglossal canal, so in the hypoglossal canal, the two bundles united and they unite to form one bundle, right? So, emerging from the hypoglossal canal, the hypoglossal nerve, it gives one important branch, that is called meningeal branch. meningeal branch, it recurs to through the hypoglossal canal. Meningeal branch, we know that what meningeal means, it supplies the meninges. It supplies the meninges, it supplies the coverings of the brain. Okay, dura, arachnoid and pyometal. It supplies the meninges of the brain in the posterior cranial fossa and also the diploid tissue of the occipital bone. So it gives a meningeal branch, it recurs to the hypoglossal canal and supplies the meninges of the brain. Okay, and then it gives another branch, that is nothing but the nerve to thyroid, as well as the genoid. Nerve to thyroid as well as the genoid. It gives one important branch, that is nothing but the nerve to thyroid. We know that C1 through hypoglossal nerve, it supplies the nerve to thyroid, and also we know that the descending hypoglossal nerve, descending hypoglossal, it supplies the superior belly of omohyoid, and also it supplies the muscles of the tongue. It supplies all the muscles of the tongue. It supplies all the muscles of the tongue except palatoglossus. This palatoglossus muscle, it is supplied by the cranial part of accessory nerve. This palatoglossus muscle, it is supplied by the cranial part of accessory nerve through pharyngeal plexus. So the cranial part of, so all the muscles of the tongue, they are supplied by the hypoglossal nerve except palatoglossal, which is supplied by the cranial part of accessory nerve through pharyngeal plexus. Okay, so that's about the hypoglossal nerve. So what are the distributing branches of the hypoglossal nerve is, one is meningeal branch and next one is, this is C1 descendens hypoglossal nerve, which supplies the superior belly of omohyoid, and here it joins with the descendens cervicalis, where form the ansa cervicalis here, which supplies the stenohyoid, stenothyroid and inferior belly of omohyoid, and it gives nerve to thyroid as well as nerve to genohyoid, C1 through hypoglossal, and it gives muscular branches here which supplies all the muscles of the tongue except palatoglossal, which is supplied by the cranial part of accessory nerve. So that's about the hypoglossal nerve. So hypoglossal nerve, it is a purely motor nerve and the 12th cranial nerve, and it arises from the hypoglossal nucleus, which is situated in the floor of the fourth ventricle from the hypoglossal triangle. Okay, so the hypoglossal nerve, it arises by two bundles, and in the hypoglossal canal they are united. First, the hypoglossal nerve lies behind the interjugular vein and intercalated artery, and also behind the 9th, 10th and 11th cranial nerves. By making a spiral run around the inferior ganglion of vagus, it comes downwards. Then first it enters the carotid triangle and enters the digestive triangle. We have discussed all these points, and branches of communication. It communicates with the lingual nerve for carrying proprioceptive fibers from the tongue muscles, and also it communicates with the pharyngeal plexus. It communicates with the superior cervical ganglion, and it communicates with the inferior ganglion of the vagus nerve. And the branches are C1 through hypoglossal, descendens hypoglossal, and nerve to thyroid, and also it supplies the muscular branches to all the tongue muscles except palatoglossus, and also it gives meningeal branch, which supplies the meninges of the posterior cranial fossa and the diploid tissue of the occipital bone. So that's about the hypoglossal nerve, which is a purely motor nerve.